Okay, Jim, you can start.
Hi, good afternoon, everyone. Yeah, today my topic is on immune system, focusing on leukemia. Yeah. Next, we'll talk about the disclaimer. So all the information contained in the slide are intended for general health information and educational purposes only, and are not intended for any be used as a substitute for professional medical advice, treatment, or care. Okay, first let us look at the statistic for cancer. So according to WHO, there were estimated about 18 million cancer cases around the world in 2018. And do know that the cancer is also the second leading cause of death. And 1 out of 6 deaths is due to cancer. For leukemia, it is ranked 13th globally in 2018. So based on historical data, WHO have predicted by 2040, which is about 20 years from now, the number of cases will be 29.4 million, which is 63% increase from now. So from 2008, it is an increase of 43%. So the number of cases don't seem to come down. So it is in an upward trend. So for Singapore, here we have the table for the top 10 cancer based on the data collected between 2014 and 2018. So leukemia ranked 9 for men. Actually, globally, leukemia is more common in men than women. So cancer is a serious health problem in all population. So from a statistical point of view, we can see that it is quite alarming that the number of cancer cases keep increasing every year. So next, let's see what we can do for ourselves to lower our risk of getting the disease. Yeah. Now we look at what is leukemia. So leukemia is a cancer of the blood and bone marrow. Take note that our blood cells are formed in the bone marrow, and our blood cells include red blood cell, white blood cell, and platelet. So cancer starts in the bone marrow and involve white blood cell, and this uncontrolled and rapid growth of white blood cell in the bone marrow. So bone marrow build immature white blood cell, also known as leukemic cell. So immature white blood cell crowding out the healthy cell. So that means that the newly grow of white blood cell multiply in an uncontrolled way and do not mature properly. And this immature cell continue to grow and eventually crowding out the healthy cell, which means the body would now have a low amount of normal white blood cell, red blood cell, and platelet. So as a result of this, it become difficult for the body to fight infection because of low. So now we look at the type of leukemia. So broadly, leukemia can be grouped into either acute type, which is the fast growing, or the chronic type, grows slowly. So note that chronic leukemia are generally harder to cure than acute leukemia. So for acute, there are two types. Okay, acute myeloid leukemia, which is most common type, and the next one will be the acute lymphocytic leukemia, which is the most common type in young children. So for acute myeloid leukemia, we call AML. For acute lymphocytic leukemia, we call short is ALL. So ALL is the most common form of cancer in children. So every year, about 30 to 40 out of a million children will be diagnosed with ALL. Of every 3 found to have cancer, 1 will have ALL. Yeah. So now we look at the chronic type. Chronic type also the same. They have 2, which is a chronic myeloid leukemia. In short we call CML, which actually affect adults. Another one is also same as the acute. They have the lymphocytic leukemia. In short, we call CLL, which is common in adults also. Yeah, next. So now we look at the difference between myeloid and lymphocytic leukemia. So the difference between them, it depends on the type of white blood cell, that affected. So be it acute or chronic. So myeloid leukemia involves the overproduction of abnormal myeloblasts. Okay, lymphocyte leukemia involves the overproduction of abnormal lymphoblasts. Blast, the meaning of blast over here is that it's immature cell. So both are actually immature white blood cells found in the bone marrow. So myeloblasts will actually eventually form a group of white blood cells, which include neutrophil, uh, eosinophil, and basophil, and monocytes. Each has their own function. Yeah. So neutrophil, the main job is to fight against bacteria and fungi infection. So eosinophil is to fight against parasite infection. Basophil is responsible for the response to allergies, and monocyte, their main job is fighting against the bacterial infection. Yeah. Next, lymphoblast is also an immature white blood cell, but usually actually develop into a healthy lymphocyte, which will eventually become T cell, B cell, and NK cell. So their main job is to help our body to fight against viral infection. Yeah. Next. Yeah. Now we look at the bone anatomy. So as blood in is formed by the bone marrow, where bone marrow can be found in our bone. So we'll first look at the bone anatomy. So in our body, bones are found in the skeleton structure, namely axial and appendicular skeleton. And we have about 80 bones in our axial skeleton and 126 in appendicular skeleton. So axial bone are those bones along a central axis or midline of our body. And the bone of the appendicular skeleton make up the rest of the skeleton. Yeah. So in terms of bone structure, the outer layer of the bone is called uh, cortical, which is a harder and compact form. And the inner layer called trabecular, which is a spongy form which contain bone marrow, which contain the marrow. Yeah. So the appendicular skeleton include bones of the shoulder, the upper limbs, the pelvic, and the lower limbs. Yeah. So bone marrow is primarily found in the axial bone, okay, particularly in the chest bone, rib, spinal bone, collarbone, shoulder blade, skull, and pelvic bones. Yeah. So bone marrow is actually located in the center of most bones and has many blood vessels. So bone marrow is considered the fourth largest organ in the body in terms of weight. Yeah. So accounting for 4% to 5% of a person's total body weight. Yeah. So the spongy bone for the rib marrow are normally found at the end of the bone. Yeah. So that is a red bone marrow. So this red bone marrow contains blood stem cell that can actually eventually will become the red blood cell, white blood cell, and platelet. And the center portion of the bone is actually contain the yellow marrow, which is mainly made of fat. Yeah. Next. Next, we look at the function. So bone marrow produces stem cell. So bone marrow is our body blood factory. So it makes stem cell that produce myeloid. They actually can go two paths. One is a myeloid cell. They actually can grow, another one is a lympho cell. So myeloid cell just now we mentioned that we eventually form red blood cell, white blood cell, and platelet. So our body make about 2 million red blood cells per second and 4 million platelet per second, and only 100K white blood cell per second. So for lympho cell, we eventually form T cell, B cell, and NK cell. So as mentioned before, all these red blood cell, white blood cell, platelet is actually have a certain function. Red blood cell is to transport oxygen and carbon dioxide, and white blood cell protect our body from invading bacteria and other pathogens. And platelet actually stop the bleeding when blood vessel is damaged or there's an injury. Yeah. Yep. Okay, now we look at the risk factor. Although the exact causes of leukemia still remain unknown, but following factor may actually increase the risk of developing leukemia. And first one will be a previous cancer treatment. Yeah, if you have done any cancer treatment, it could be a higher risk. So genetic disorder and exposure to certain chemical, smoking, if you are a smoker, and family history of leukemia. However, vast majority of the patient appear to be not known risk factor. Yeah. Next, we'll look at the symptom. As for the symptom, for common symptom for leukemia, it could be you may actually experience weight loss, fever, frequent infection. Your lung side you may be have easy shortness of breath and muscular weaknesses, and your bone and joint you may experience some pain, but this kind of pain is continuous and tenderness, and always feel fatigue, and you have loss of appetite for a very long time. Your lymph nodes start swelling, okay, for a very long time, and your spleen or liver enlarge, and your skin like night sweat, easy bleeding or bruising. Yeah, bruising is very obvious. Yeah, so purplish patch of spot. So these are the common symptoms, but it's good to have a check because those symptoms are not easy to detect ourselves. Yeah. Next. Now we look at the staging of leukemia. Okay, for most cancer, determine the stage of cancer is helpful in deciding on the treatment option. In fact, staging is a way of describing where the cancer is located or where it has spread and whether it is affecting other parts of the body. So for most cancer, determining the stage is helpful in deciding the treatment, and knowing the stage would actually help the doctor to decide what kind of treatment is best. So different leukemia type have different staging system. So it's not so straightforward like other cancer that you have stage 1, stage 2, stage 3, stage 4. So different type of leukemia will have different staging, but mainly it's for the doctor, it's not for us because of a treatment option. So the first one we will look at is AML, the acute myeloid leukemia. So for this AML is actually divided, okay, into um, a different FAB system. And AML and AL are staged based on how the cancer look under a microscope and the type of cell involved. Yeah. And the stage are based on the white blood cell count at the time of diagnosis. Yeah. So let me see. Yeah. So AML is actually divided into subtype based on FAB system. It's a French, American, British system. So there are total 9 subtypes. So the subtype are actually determined by looking at the maturity of the leukemia cell and where they came from in your body. So WHO had actually further breaking down AML into further subtype. So the subtype can actually be used along with the FAB, which is a French American British system subtype, to help the doctor develop a treatment plan that might work best for the situation. Yeah. So for ALL, okay, acute lymphocytic leukemia, it actually split into to children and adults. So for children, they actually split into two category: lower risk, low risk, and high risk. So for the age less than 10 and white blood cell count less than 50,000, so they consider low risk. Okay, which is when the children age above 10, or they found that their white blood cell count is greater than 50,000, that would consider a high risk. Okay, so next we look at the adult. Adult also stage differently. They stage into three stages: untreated, in remission, or recurrent. So untreated, there are those who actually newly diagnosed and before treatment. Okay, so in remission, they actually count as a remission occur after cancer treatment has done. Yeah. So recurrent, the stage occur when your leukemia come back after remission. You will need another round of testing and more treatment at that stage. Yeah. So for CML, chronic myeloid leukemia, it's actually staging is based on a percentage of the cancerous white blood cell count, the blood cell, meaning the immature white blood cell. So they split into three stages for this CML: chronic, accelerated, blasted. So chronic actually respond well to treatment, but for accelerated does not respond well to treatment. Yeah. So for the last one, the blasted, aggressive stage. So the blood cell will have spread throughout your body, making treatment more challenging and more difficult. Yeah. So next will be the CLL, the chronic lymphocytic leukemia. So this one they actually group into two types of system. Okay, some hospital may use RISE system, some hospital may use BINET system. So if they use RISE system, they actually based on three factors for RISE system: the number of cancerous white blood cell in your body, and or they based on the number of red blood cell and platelet in your body. And the third one will be whether or not your lymph node, spleen, or liver are enlarged. Yeah. So they further split into 5 stages. Yeah. So from the system itself, they identify the cancerous, the cancerous white blood cell. Now they move into the staging, the 5 stages. High stage represent a worse prognosis and a lower survival rate. So they stage from 0 to 4. So for BINET system, if they use BINET system, then it will be different. The number of tissue, they will use the number of tissues groups affected by the lymphocyte and the present of anemia to stage, the present of the anemia to stage. So there are 3 stages, A, B, C. Yeah. Now we look at the diagnosis. Yeah, for diagnosis, the first one will be the physical examination. So the first check is to see whether any swelling in the liver, spleen, or lymph nodes, or unusual bleeding or bruising. To see as a general sign of health, and look for all these area to see any sign of infection. Yeah. So for blood test, it's a full blood count to check the proportion of blood cell. So a high proportion of white blood cell may indicate ALL. Okay, and a high proportion of lymphocyte, over 5,000 lymphocyte per minute cube, along with low level of red blood cell and platelet may actually indicate CLL. Yeah. So the next will be tissue biopsy. So doctor will actually take sample of bone marrow from the hip bone for examination. Yeah. So there'll be further tests to confirm. So flow cytometry will actually examine the DNA or of the cancer cell and determine their growth rate. So flow cytometry, as you can see on the picture, is a kind of a specialized machine that tests to identify CLL cell in a blood sample or bone marrow sample. Next will be a liver function test to show whether leukemia cells are affecting the liver. So third one will be lumbar puncture. It's performed by inserting a thin needle between the vertebrae of your lower back. And this is a medical procedure that actually involves collecting the fluid sample from your spinal cord for lab tests. So the last one is the common one will be the imaging tests such as X-ray, ultrasound, and CT scan. Okay, for prevention, so far there is no known way to prevent most type of leukemia, and most people with leukemia do not have no risk factor. So until more research is done that find specific way to prevent leukemia, the best method is to reduce the risk factor we can control. So we can reduce our risk of leukemia by actually lifestyle change. Example, if you're a smoker, quit smoking. Okay, maintain a moderate weight. And avoid exposure to radiation or chemical enzyme, and exercise regularly. Another one will be eating healthier and balanced diet. Okay, this one is not specific for leukemia, it's for general health also, especially food that have been in the study that may help to lower the risk of cancer. Example, broccoli, dairy, nuts, olive oil, turmeric, and tomatoes and garlic, yeah, etc. Next. Treatment. Yeah. So the common treatment used to fight leukemia include chemotherapy. So this one is to use a drug to kill leukemia cell, but they will actually affect the good cell as well. Yeah. So targeted therapy. So targeted therapy, they are using targeted drug to actually focus their target specifically on specific protein or genetic mutation within the leukemia cell so as to destroy or block their growth. So next will be the radiotherapy. So radiotherapy is to localize treatment using the high energy ray. It may be given together with chemotherapy. And next will be stem cell transplant. So this one require the healthy stem cell. They use actually higher dose of chemotherapy together or radiotherapy to kill cancer cell. Yeah, which is the leukemia cell. After the chemo treatment, the stem cell, the healthy stem cell are then put back into the patient's blood. Yeah. Next will be the immunotherapy. So immunotherapy uses our immune system to fight cancer. Yeah. So last one will be engineering immune system to fight leukemia. So this is a specialized treatment called CAR, chimeric antigen receptor, that special kind of therapy that take your body germ fighting T cell, engineer them to fight cancer and infuse them back into your body. Yeah. So next. Yeah, next we will look at the consumption of the health food. We can consider a good number of health food that has the ability in regulating our physical constitution and immunity, as they can actually lay the foundation to control the growth of cancer cell. One of them is Ganoderma, or we call Lingzhi. It has been regarded as a top grade health food in enhancing health. Next. Okay, Ganoderma, also known as Lingzhi, is a very special type of mushroom that has the healing property. And it has been recognized as a medicinal mushroom for over 2,000 years back in China. And its a powerful effect have been documented in two oldest medical books in ancient China, Shen Nong Ben Cao Jing and Ben Cao Gang. So in the past 50 years of modern scientific research in Lingzhi, we can find many evidence-based reports published. More than 2,000 uh, 2,800 search result if you do a keyword search, put Ganoderma on the latest 20 November 2021. You do a search, you can actually find a lot of evidence-based research, okay, on the PubMed, which is a U.S. National Library of Medicine, National Institute of Health. It's a repository for all the medical research that published over there. Yeah. Next. Now we look at Ganoderma on cancer supplement treatment. Yeah. So look at the right picture of the body system diagram. That it consists of many systems, okay, our body, and each system has their own problem and diseases. Now we look at what the function and benefit of this Ganoderma can help, okay, in all of this system. So the number one is to regulate immune system. Yeah. So it fortify immune system, defense of cancer prevention. So immune system is like the soldier who defend the country from being attacked by the enemy. So that will also help to reduce the chances of infection during treatment. So immune system must be regulated. So cannot be too high or cannot be too low. So it, it will actually protect our own body. So too low, it will get infection easily. Yeah. So number two is to improve blood circulation. Yes, this is important as the blood circulation is like a transport system that actually help to deliver oxygen and nutrients to the whole body. Any part of the system will be at risk if they don't get their required oxygen and nutrients. So in TCM perspective, smooth flow of blood and qi can actually prevent formation of lung. Yeah. So number three, enhance liver function and or detoxification. So Lingzhi actually help to prevent potential side effect of drug on liver. So elevated liver enzyme, example is an elevated liver enzyme. High liver enzyme means that liver is probably is having injury, damage. So it is important that liver function is good at all times, especially during the treatment period, in order to clear away the waste toxin caused by the drug. So number four, remove free radical and antioxidation. So free radical actually cause damage to the DNA cell. They are linked to many diseases. Yeah. So such as diabetes, heart disease, and cancer. So the reason why Lingzhi is so unique that has all these function and benefit is because two major special components, terpenoid and micromolecular polysaccharide. Yeah. Next. Yeah. So now we look at the Ganoderma in assisting cancer treatment. Well, how is their approach? So for the first approach is that the prevention of cancer cell proliferation or metastasis. So this means that it actually spread. Okay, meaning meaning stop cancer cell from rapid growth of or spread. So how they do it? They actually induce autopsies. So, and to kill cancer cell directly, autopsy is a natural process of body, the cell will actually do a programmed cell death in our own cell. So once you grow mature, they will actually go to a stage. Yeah. So Lingzhi is able to induce that kind of process to kill the cancer cell. That will increase the patient's survival rate once cancer cells are killed. Okay, the second approach is to complement treatment to chemo and radiotherapy. So by antioxidation and stimulating mechanism such as the bone marrow, hematopoietic, formation of blood cellular component and liver protection. So the bone marrow is the primary site of hemo, hematopoiesis, that is where all blood and immune system are formed. So during chemotherapy treatment, the chemo drug make it harder for the bone marrow to make blood cells the way that it normally does. So nearly all chemotherapy drugs cause a drop in the blood cell count, also commonly known as bone marrow suppression. So next is to reduce the side effect of the chemotherapy and radiotherapy treatment. Yeah. So there are many evidence-based research also of this Ganoderma on cancer treatment. In fact, just now I mentioned about PubMed. Okay, now the latest search you can actually find out 625 publications on this Ganoderma and cancer. So all these so-called evidence-based research have been actually published in the Central Repository in the U.S. National Library of Medicine National Institute of Health. Yeah, you can actually interested. You can actually do a Google. You can find a lot over there. Yeah. Next. Yeah. Now we look at the research and technical paper on this. Yeah, prevention of cancer cell proliferation or metastasis. Yeah, here we would like to show you some of the research and experiment done on prevention of cancer cell proliferation or metastasis. So the research actually focused on using Lingzhi component, terpenoid and polysaccharide to study their effectiveness of inhibiting the growth of cancer cell. So the summary of the results show that the two components, terpenoid, and polysaccharide, have the ability in stopping the growth of cancer cell, but in different approaches. Yeah, so terpenoid is able to inhibit new vessel formation in direct manner, as opposed to the indirect action, okay, of polysaccharide. First, they strengthening the immune molecule that later inhibit new vessel formation. Cancer cells are like our normal cell, that they will do cell division and grow. So they will form new blood vessels in order to get their food for survival. So our normal cell will die, mature, grow, and will die, as they have followed the apoptosis pre-programmed cell death when they are matured to be replaced by the new divided cell. So this is normal process for healthy cell. Yeah. As for cancer cell, they do not have the pre-programmed cell death function, and they keep multiplying. Yeah. So the research found that Lingzhi can actually help to inhibit the cancer cell from growing new vessel. So without the blood vessel, the cancer cell will be starved, okay, and slow down the growth. The effect caused the cancer cell eventually stop the growth. Yeah. So in addition, one of the experiments also showed that both terpenoids and polysaccharide need high dosage in order to have the prominent effect on human tissue inhibition. Yeah. Next. Yeah. Now we look at the Lingzhi Research, okay, on leukemia. Yeah, here we have the research, okay, from Taiwan, published in a PubMed also, and the title, Ganoderma Lucidum polysaccharide induced macrophage-like differentiation in human leukemia THP1 cell via CAPS and P53 activation. So this activation is actually related to program cell death. Yeah. And here the label F3 is actually referring to polysaccharide. Yeah. So they have conducted in vitro study to actually investigate how F3, meaning the polysaccharide, can induce the differentiation in human leukemia THP1 cell. So THP1 cell is a human leukemia cell. It's a cancer cell. Yeah, or leukemia. So they will actually do the study and analyze and modeling to study how the polysaccharide induced effect on this cancer cell THP1. And the study of this leukemia cell differentiation into macrophage-like cell induced by this polysaccharide. So THP1 cell were actually treated with a certain amount of polysaccharide, which is 30 grams per milliliter of this polysaccharide for different time courses. So the chart on the right show that the number of so-called macrophage-like cell increase. So the cancer cell become so-called mature to become a macrophage-like cell. So it actually the number increase. So when exposed to longer time to polysaccharide, yeah. So the bottom diagram, the bottom so-called the diagram, actually show the cell differentiation process. Yeah, after cancer cell being exposed to polysaccharide. So what is cell differentiation? Differentiation is a process that the young and immature cell actually grow to reach their mature form. Yes. So the result show that polysaccharide can actually induce leukemia cell differentiation to macrophage-like cell. So this is what they have done. The key takeaway from this so-called the research is that they actually prove that it can actually induce the leukemia cell to become a macrophage-like cell. So when this macrophage cell go to that stage, they will actually go through the so-called programmed cell death and eventually will be mature to death. Yeah. Next. We now look at another research. This is from the United States. The title is Ganoderma syndrome causes autopsis in leukemia and or lymphoma. So Ganoderma syndrome extract was actually what they have done is that they actually extract the Ganoderma based on the anti-proliferative activity using a panel of 26 human cancer cell lines. So they are all 26, all are cancer cell lines. So of the 26 cancer cell lines, they actually take out 4 most sensitive hematologic cells, okay, which is related to leukemia, the blood cancer, and to do the study. So the 4 are HL60, Blin1, U937, and so-called RPMI 8226. So these are the 4 cell lines that being examined for autopsy, yeah, using the Ganoderma extract. So from the experiment, they actually, if you look at the chart on the right, they observe that the number of cancer cells will actually drop, okay, when subject to a high amount of Ganoderma syndrome extract. So these are 4 types of cells. Yeah. So the study actually, the key takeaway for this study is that they found that the Ganoderma syndrome extract has a profound activity that actually causes the autopsies in leukemia, lymphoma, and multiple myeloma cell. Yeah. Next. Yeah. So now we come to Shuang or Ganoderma Lingzhi. So when it comes to selecting Lingzhi product, you will be spoiled for choice in the market. So why would you choose Shuang? Okay, first, Shuang is one of the world leader in producing top quality Lingzhi. Their main core business is in research, producing, and marketing the Lingzhi. So the company has been in the business for more than 32 years and specialized in producing top-grade Lingzhi product. Head office is in Taiwan and named as Double Cream. In the Southeast Asia region, it named as Shuang. Yeah. So the company owns their in-house R&D, Lingzhi farm, as well as the distribution network. So through many years of research effort with its patented extraction process, all Lingzhi products are actually extracted with the 2 unique components, terpenoid and micromolecule polysaccharide content. So, and the product has been scientifically certified with various endorsements, yeah, such as Singapore, HSA, Taiwan quality food, also halal certified, as well as ISO. Yeah. Next. Okay, so here we have a different dosage at for different needs. Yeah. So this is a recommended dosage plan based on the result gathered from the leader and the user. So on the left vertical y-axis, extreme left, that represent the dosage number. Yeah. So on the bottom x-axis is the time or stage of the cancer. Yeah. So for example, if you look at the cancer stage 1, yeah, or in the case of early stage, the dosage would be 30 capsule of YK1 per day or 5 capsule of YK2 per day. Yeah. So when we look at the chart on the right, okay, for long-term cancer prevention, yeah, we can actually reduce the dosage accordingly to the to a number of years after remission. So for example, 1 year after remission, the recommended dosage would be dropped to 30 YK1 as a minimum. Yeah, once more than 5 years, after another example would be once more than 5 years after remission, which is on the extreme right, you can actually reduce to 12K1, okay, as the maintenance of the long-term cancer prevention. So this is how we use the chart. Yeah, just for recommendation dosage. Okay, now we look at testimonial. So the first testimonial is from Taiwan, Mr. Chai. Yeah, Mr. Chai, age 31, back in 2010. So this is the acute leukemia case. Yeah. So he had past history of stomach perforation, meaning there's a hole there. So around the hole in the stomach, yeah. So around mid of 2010, he actually suspected he got food poisoning from a night market. Yeah, he takes supper, then he got suspect that he got food poisoning, so he got diarrhea, he got vomit, and he felt not well for about a month. Yeah. So during that period, one night after that he actually fainted. Okay, one night he fainted and he had cardiac arrest. So he was sent to hospital after he recovered from the cardiac arrest. Yeah, so doctor really found that doctor found no abnormality in heart function, except the blood count was too low for platelet and red blood cell. So initial suspect was internal bleeding or bruise in the body, and doctor found nothing related to that. So further investigation by the hematologist confirmed the condition was is condition of a leukemia. So on the 1st October 2010, his father did a research and find a reliable so-called Lingzhi source, and he actually spent 30,000 NT dollar, which is current equivalent to 14,700 on Lingzhi to let Mr. Chai take immediately. Yeah. So at the time, he was bedridden in hospital waiting for treatment. And his father continued to feed him, okay, starting from 20 capsules per day and increase, okay, daily to 80 capsules a day, okay, with the hope that he can actually recover fast. So on the third day, 3rd of October 2010, doctor told the family that it was too late for any treatment as his condition had worsened and he had only 3 days to live. So the family was quite sad. So on the 6th, the family still continued to give him Lingzhi, okay, with the hope. So another 3 days passed. On the 6th of October, doctor was so surprised of his improved condition. So they realized that, oh yeah, so they can actually let him start the chemo treatment. Yeah. So at that time, he also continued to consume the Lingzhi and continue during the treatment. And after after a while, he had good appetite during treatment. Hair loss was the only side effect. So on May 2011, which is after 7 months, he recovered and discharged from hospital. So his health condition improved and continued the Lingzhi until April 2012, which is about a year and a half. So the key takeaway is that effect of high dosage at critical time and reduce the side effect during the treatment. Yeah, and this one I put the link is from the source of Ganoderma magazine. So anyone interested can actually look further into this magazine. Yeah. Okay, second testimonial is also from Taiwan, Mr. Wu, an 8-year-old boy back in 2007. So this is a ALL cause, which is an acute lymphocytic leukemia case. Okay, the young boy always complained about knee pain, okay, when he was 5 years old, okay. Doctor found nothing wrong with his bone x-ray, blood sugar, they thought that it's uric acid, they found nothing wrong, okay. So his knee condition became worse and he started to actually complain, but can't find anything. And it came to be, he started limping. So after 1 month, yeah, after all these things, after 1 month, he started to have fever and experience pain on the skin whenever somebody touching or in contact with anything, he feel pain on the skin. He was later diagnosed with acute, lymphocytic leukemia after detailed examination in hospital. Yeah, so he started the treatment on chemotherapy to kill the cancer cell, and also start the antibiotic to prevent bacterial infection. And doctor prescribed steroid to support the cancer treatment and the blood infusion. His fever and temperature still in fluctuation. Yeah. So at that time, so about 3 weeks, he started to consume Lingzhi 4 times per day, and each time 1 sachet of Lingzhi powder. Yeah. So 4 times, each time 1 sachet Lingzhi powder. So after 1 week of taking this Lingzhi, his condition improved with no fever and no need for blood infusion. Yeah. So he continued the Lingzhi with the dosage increased to 5 times per day. Yeah. Each time 2 sachet and with 4 sachet a day per day. Yeah. So he discharged after 44 days in hospital. And the original 3-year plan of chemotherapy, he actually, after that, he started the so-called chemotherapy. So doctor actually original plan for 3 years of chemotherapy. And along the way, because of his condition improved, the chemotherapy had reduced to 2.5 years. Yeah. So his condition has been consistently in a stable stage. So as a result of his improved condition, the drug dosage also been revised by the doctor and reduced accordingly. Yeah. So the key takeaway of this testimony is that they consume Lingzhi during chemo to actually complement the treatment. It helps. And high dosage to improve the efficacy effect. Dosage is safe for everyone. Yeah. Next. Yeah. Another quality product from the company is the Lingzhi colon. So it comes with most complete food and has the nutrient that we need for our body. It has more than 16 vitamin, more than 16 mineral, and 21 amino acid, 21 nucleic acid, more than 94 enzyme coenzyme. So health benefit include regulate nutritional imbalance, calm our nerve, increase stamina, and remove fatigue. And more importantly, it helps to enhance the absorption of Lingzhi. So as mentioned before, for prevention, we need to eat healthy. So it means that we need to get food, nutrient from uh, from what we eat, and hence pollen can actually supplement our body with the nutrient we need. Yeah. Yeah. Okay. So the key takeaway is that cancer is still one of the most dreaded diseases. Uh, Ganoderma is one of the best health food to prevent and also complement the treatment of cancer. And Ganoderma enhances our body immune system. Use of Ganoderma together, okay, as we can see from the testimony and the research paper, used together before, during, and after treatment, chemotherapy, radiotherapy, in fact, is very effective in improving the overall health condition. Yeah. So other stronghold products such as bee pollen, protein powder can also be consumed as part of our balanced diet. Yeah. With that, I end my presentation. Thank you, everyone.